Hello, and thank you for joining the Be Well or Die podcast. I am your host, Dr. Silvio Cozzetto. And here we have today Nurse Ashley. Hello, Nurse Ashley.
Hello. How's it going?
I sound so official.
Yeah, you do.
I know, I like it. New job. Peyton, we're leaving.
Gotta go.
Turning into a podcast studio.
We're official.
Anyways, today, what are we talking about?
Today, we are talking about all the amazing benefits of NAD.
Ashley said, don't ask her what it stands for.
No, I know what it stands for. I want to be clear. You guys can all Google it yourselves, but I cannot pronounce it, so I will not do that to myself.
You're fine. I'm just messing with you. So let's start with the general, like, I'm tired, I feel old, I'm getting wrinkly, parts don't work anymore.
Yeah.
Is NAD beneficial for that?
NAD is beneficial for, it's just crazy. It's beneficial for so many things, but yes, that is one of them. It's kind of like an anti-aging miracle. It has been in studies for just a numerous amount of different problems that we tend to find when we're older in life. Should we get into that?
Are we going to talk about the telomeres?
You can talk about the telomeres.
And the mitochondria.
And all of the energizers of the cell, yes.
So should we cellular it down first and then speak about how it works? Or
yeah, you the cellular, and I'll then make it English for everybody else.
Okay, so I won't get too technical on it, but we'll say that the cells have what's called the mitochondria, and the mitochondria are called the powerhouses of the cell.
Bio 101.
Exactly. It's what feeds the cell and gives it its energy. As we get older, the mitochondria has become weaker. They have what's called a telomere on them, and those telomere lengths are how the powerhouse gets its power. Mm-hmm. And a certain body-produced chemical called nicotinamide adenosine dinucleotide.
There it is.
AKA NAD powers up the mitochondria, the telomeres. And that's what gives the cell its power. So as we get older, not only does other things sag, but so do the telomeres.
Indeed.
So telomere strength, mitochondrial strength, cellular strength, and the ability for the cells to properly split and die off and reproduce. That's the word I'm looking for. Hello, folks. First day on the job. Comes from the NAD. And now you have other things like NMN and resveratrol, which creates NAD production and carries the NAD throughout the cell. But we'll talk about that on another podcast. Mm-hmm. So now that we know how telomeres and mitochondria and cells get strong, how do you feel?
How do I feel?
No, like, how will it make you feel?
Oh,
sorry.
Okay.
I should have phrased that a little better.
I feel okay. Okay, so NAD. So what we're really doing is, as we age, let's do the Ashley version of what NAD does now. As we age, we produce less and less of NAD, therefore we don't have these energizers to create cells, so certain cells start to shut off, and that is how we see that, we're not producing as much collagen as we used to be. We'd maybe have more brain fog than we used to. We might not have as much energy as we used to. Our metabolism has slowed down over time. That's because these certain cells are starting to turn off, because that's the beauty of aging. But here at Be Well, we do not age, and that is because we have NAD that we can inject directly into your bloodstream. It's very safe. It has been studied for years and years and years. Is a little bit of background and medical history we'll do on you beforehand to make sure that it is safe for you to do. And we don't allow, this isn't for the 24-year-olds of the world. This is for, you're 28, 29 and up. You're starting to notice these effects, and you want to, benefit from getting NAD injected.
That was boring.
Okay, well, that's the truth.
No, I liked it. It was boring.
Okay, well then, do you want to talk about what you act like when you get NAD?
Oh my God, I'm such a baby.
He's a big baby, I'll tell you that much.
So NAD causes the body to release niacin really, really, really fast, and it detoxes the body extremely fast. As a result, you feel like shit.
Okay. exaggeration.
Okay, sorry. I feel like shit.
There we go. Silvio's a baby.
I completely admit I am a gigantic baby when it comes to NAD. So what happens when the niacin's released? You get this like cramping feeling. You get flu-like symptoms. You start to feel foggy. You may even feel numbing and tingling in the hands. It is temporary. It is if you're doing the NAD fast. Some places will do it over 3 or 4 hours or 2 or 3 hours, which I can't sit still for.
No, that's crazy.
But if you were to do it that slow, you would probably experience no symptoms during the IV. Second, you pull it out and turn the IV off, you feel amazing.
This is true. So it only lasts during about an hour-long period where you're sitting there and actually receiving that medication. But we do make sure to give you something called Zofran beforehand, which is an anti-nausea medication, because some people tend to feel some nausea while doing it. So we prevent that. And we also make sure I sit in there and hang out with you, so that way if you wanted to go faster and get it over with, great, I got you. If you want to slow it down, this guy, then I got you on that too, and I will talk to you and distract you the whole time, so that way it really flies by pretty quickly usually. It's not too bad.
No, it sucks. I'll say that right now. But I will say this. The fact that I've been doing it for so long and going back for more must mean that I truly do believe in it, because to go through that, someone described it, a few different people describe it as period-like symptoms.
You get some cramping, which is why women tolerate it way better than men do.
Yes, admittedly so. We are very vulnerable to that feeling.
And to all feelings. Okay, let's talk about how amazing people have felt post-NAD.
So I know that my body has gone through major changes. My ability to think properly, my ADD, which is significantly intense, has become a lot less significantly intense. Now I'm just like normal ADD.
Yeah.
I can think straight. My computation skills have improved. My clarity, my sleep, it's just off the charts on how I feel, and like, holy shit. And then also I want to state this. A lot of people are taking NAD in a shot form.
Yeah.
I don't think it works the same because your body's not absorbing it. What are your thoughts on that?
You know, it's going to work, but just like, it's just kind of, I like to compare it to, you take an oral vitamin, you're going to absorb 30 to 40% of it, but you take an IV vitamin and you absorb 90 to 100% of it. This is the same thing. So you're spending probably a similar amount of money, but you have to inject it every day. You feel nauseous every day. You don't have just this 1 hour of discomfort and then you're good for a couple months until the next time you do it. So it doesn't, and you just receive it better. So I mean, it's kind of silly to do the shots when you have this alternative, in my personal opinion, from all of the research that I've seen, and just from client testimonials as well, who people have started with the shots and then they're like, I stopped doing them because I just felt crummy every day. And when I saw that you did it IV, I just came here and did it there, and it's in and out and you're good to go. So it's pretty nice.
Nice.
I also want to say that for me, when I did NAD, I was able to get off of my Adderall prescription, which is pretty amazing. And obviously this have effects differently on different people. But for me, I'll always tell the story that I had my bathroom counter at home. I always wanted to clean it. I just could not bring myself to do it. If I was going to do it, then I'd take my Adderall in order to just get it clean. And then I did NAD for the first time. And the next day, I just went and had cleaned my bathroom counter, and I finished, and I was like, holy crap, I just did that, and it wasn't like a huge task, and I didn't have to procrastinate or bribe myself to do it, and it was like the most amazing feeling ever. So I will always tell that story because it was very emotional for me. I literally cried because I was like, holy crap, this is only the ADD people, you'll get that. You will understand that, because it is tough sometimes to just do mundane tasks.
Oh, agreed.
Yeah. Other clients have told me they have stopped having horrible panic attacks. I've had a client who told me that he no longer had suicidal ideations after NAD. I've had clients that have way more energy, have been able to get rid of they were hitting a plateau at the gym and they're able to reach past that and continue to lose weight. I've just heard so many amazing stories from this that it has to work. I mean, Silvio and I know for sure that it works because we do it ourselves. So
I'm definitely sold.
Yeah.
One thing I want to point out is that I don't want to say it was created because it's actually naturally found in the body, but it was used for Alzheimer's patients initially.
And Parkinson's. Yes, it's currently in trials for both right now, so that's pretty amazing. And also in trials for addiction therapy right now. Because, of course, the U.S. only does it for things that are already problems, and they don't do it to prevent those problems. But other countries, like in Europe,
100%.
they are utilizing it already just for us regular people who don't have these terrible things just yet, and now we can prevent them too, which is pretty nice.
I will also say that when you have... I've read certain studies when you take NAD, when you have NAD, it does help with certain cancer cells and fighting off certain oxidation in the body, which helps to fight cancerous cells, mutated cells that shouldn't be in the body. Now, also, I'm not saying it cures cancer just because I couldn't say it, wouldn't say it, don't say it. But there are certain types of cancers that are actually contraindicated.
There it is.
Sorry, first day with my new mouth. To taking NAD. So you have to really, that's one thing I really appreciate about you and the whole system over here at Be Well is that we're not just going to hop on it.
Right.
If somebody comes in, an everyday average person with, no known illnesses, anything like that, perfectly fine, come on in.
Go, yeah.
But if somebody says, I have a history of this disease, this dysfunction, this problem, we're always going to say, go to your doctor and ask,
Yeah, we need their permission first just to make sure that it's not going to cause any harm.
Yeah, there's a lot of places out there that are definitely just throwing it at you, and too much also. I think the 1,000 milligrams is just way too much.
And it's doesn't really prove that it has any bigger differences from getting it. So you're paying more, you're suffering more, and it doesn't really do anything different. So we keep the doses 250 milligrams or 500 milligrams, and you're going to see the benefits from that. You do not have to worry about getting any extra, and we're not going to upcharge you just because then we make more money, because that's crazy town.
Exactly. And I will definitely say personally, I am 100% sold on it. I've seen the benefits. I stand by the benefits.
Same.
And I think everybody that's come through here has stood by their benefits.
They keep coming back, so clearly it's pretty amazing.
All right, so if you want to reverse age, anti-age, feel better, stop the sagging,
get smarter,
lose the ADD, clean your bathroom, and just feel better all over, NAD seems to be the go-to.
Yeah, so come see us and we will help you out.
Awesome. Put your time and your money and yourself into improving yourself, and do it at Be Well.
Yes. Do that.
Nurse Ashley, I thank you for your time. And if you guys need us, 248-792-6570, BeWellLifestyleCenters.com. You can email us. You can smoke signal us. You can do whatever you want. We're easy to find. Thank you very much for joining us.
Have a good one, guys.
Peace.